Good morning, everyone. I'm Dr. Jyoti Patel. Sorry for the little delay. I had some technical difficulties this morning. So welcome. Today we're going to talk about arthritis and inflammation. I practice internal medicine and pediatrics and integrative medicine. So welcome this morning. We're going to cover a number of topics on arthritis today. As we have a large growing number of baby boomers, this is going to be a big topic that patients are going to want to hear about, how to help yourself naturally with inflammation and joint pain. Again, it's important to know what arthritis is. People always confuse osteoarthritis and osteoporosis. So I'm going to start by just talking about what I mean when we talk about arthritis. Arthritis is inflammation in the joint space between the bones, whereas osteoporosis is thinning of the actual bones. Osteoporosis increases the risk of fractures and usually doesn't cause any pain, whereas arthritis causes swelling, stiffness, pain, limitation in functioning in the joint itself, which then decreases the quality of life of the person. So if you know somebody with arthritis and they have stopped walking around the park, or they aren't coming out to engage in family activities because their joints hurt, or they can't exercise because they say that their joints hurt, share this video on your personal feed so that they can benefit from some of this information as well. Okay, so today, what I'm going to do is I'm going to cover the topics of nutrition, gut health, supplements, exercise, mind-body work, and manual therapy when treating arthritis. So let's start with nutrition. Most people know that what you eat is what you are, right? So Hippocrates has said long time ago, you are what you eat, and all diseases start in the gut. So let's start with the gut. Gut and inflammation have a lot to do with each other. So when you eat food, that food enters into your colon. Your colon is covered with trillions of bacteria that are there to help support you. But if you eat the wrong things, pesticide-laden food, artificial sweeteners, sugary foods, high-fat, hydrogenated foods, these foods can cause inflammation in the gut lining, causes separation of the cells, which allows this inflammation to enter into your bloodstream. And then this inflammation can actually lead to systemic inflammation, including joint pain. So know that there are sometimes people that are sensitive to certain foods. So if you are eating a lot of things like gluten and wheat, and that causes sensitivity for you in your joints, you may want to cut that back. A common inflammatory trigger is dairy. So a lot of times I tell patients to experiment with changing their nutrition to see what might be triggering their arthritis. And all of us are individuals. So sometimes it might be healthy foods that might be a trigger, or it might be unhealthy foods. So try to find food triggers, try to eliminate the processed food, the high sugary foods, the hydrogenated fats initially. Last week, we talked about certain diets. We talked about the anti-inflammatory diet or the Mediterranean diet. So if you do have arthritis and you're worried about inflammation, I encourage you to look up the anti-inflammatory diet by Dr. Andrew Weil or the Mediterranean diet, because this particular diet is geared for people that have inflammation, and they've done a lot of good studies to show that if you follow this type of eating pattern, you might be able to help your inflammation. So what does this involve? It involves fruits, vegetables, whole or cracked grains, using very little but more nut butters or nuts and seeds, and certain vegetable-based oils like avocado and olive oil, and staying away from dairy foods like eggs and cheese and butter and poultry, and sticking to fish. So remember, an anti-inflammatory diet is designed to decrease inflammation in your system, and also then by helping your joint inflammation. Some people will ask me about supplements. They'll say, are there any supplements that you recommend for joint inflammation? Well, there's been a lot of studies to show that supplements can help. So here's the 411 on that. There have been some studies done on glucosamine chondroitin, probably the #1 supplement that people take for arthritis. 1,500 milligrams once a day was tested, and some studies that actually did show to slow down the progression of arthritis. So it would be something that you would actually take every day to keep your inflammation from progressing. So if you have cartilage that's getting thinner, consider glucosamine chondroitin. There were some mixed reviews, or at least it was anecdotal in terms of helping with joint pain itself. Another natural remedy that's been evaluated closely for joint inflammation is turmeric or curcumin, and it has some amazing properties that are very similar to some of the prescription and over-the-counter arthritis medications, COX-1, COX-2 inhibition, tackling some inflammation markers like TNF and IL-1. So, I really am a big fan of taking turmeric, and I recommend my arthritis patients at least give it a try for 30 to 60 days. And the dose is about 1,000 milligrams of turmeric a day. Make sure it has black pepper in it, because the black pepper actually helps with the absorption of the turmeric into your system. Good morning, Becky. Thanks for joining me. So think of glucosamine chondroitin to help stop the progression of your arthritis. Think about turmeric to decrease the inflammation in your arteries. The next one that's really well studied is fish oil or omega-3 fatty acids. So just, again, if it's in your dietary pattern and you like to take fish or fish oil, this might be another way to decrease inflammation markers. Studies show that it decreases COX-1, COX-2, TNF, IL-1. These are all inflammation markers or cytokines that are measured in the bloodstream, and when people take these supplements, it has been shown to help decrease these inflammation markers. Good morning, Deanna and Greta. Welcome. So we just talked about glucosamine chondroitin, turmeric, and also fish oil to add to your supplement list if you suffer from chronic arthritis. So again, what else has been studied? Avocado, soybean product called ASU. That has also been studied to help decrease joint pain. So look at ASU, avocado soybean product. Two of the other ones that I like are Sammy. If you've never heard of Sammy, it's a methylated product. It helps with not only joint pain, but depression. And it's not uncommon that a lot of my senior patients that suffer from joint pain have trouble with sleep, disability, and chronic pain, and also then thereby have depression. So CME tends to be a nice little pearl for people that have depression and joint pain, and it's all natural. So, again, you don't need a prescription for any of these things. You can find them at any health food store. If you're having acute pain, so this is what I mentioned before was just stuff that you could take every day to keep your inflammation at bay, but sometimes people want to take something when they're having pain. So what has been studied? There's some herbal remedies, cat's claw, devil's claw, willow, and then also I think bromelain. Bromelain is something that you get from pineapples, and that has also been studied to help decrease acute joint pain. So if you're having joint pain now and you need something acute and you don't want to take, ibuprofen or Aleve or Tylenol because you have liver and kidney problems, maybe you want to look at the health food store, look for some cat's claw or devil's claw, or look at willow bark, which has been shown to help decrease acute pain. Another one is MSM. M, Mary, Sam, M, Mary. That has also been shown to help decrease acute pain. So look at MSM. It's an aspirin-like product, so if you're allergic to aspirin, probably don't want to go there. There's also ginger. People love ginger. Ginger has anti-inflammatory properties for joints, so think about adding ginger to your tea every morning if you suffer from arthritis. Okay, if anybody has any questions, please place them in the comments. I'm going to keep talking, but if there's anything specific that you have questions about, if I say anything that you want me to go back over, please let me know, okay? So nutrition is the one thing. You want to improve your gut health if you want to decrease inflammation. Another thing with gut health is when you eat the wrong foods, not only does it cause systemic inflammation, but it also leads to weight gain. And weight gain is the number one, the strongest modifiable factor when treating arthritis. So if you can lose the weight, you can actually help decrease inflammation and decrease joint pain. So one of the leading experts, integrative experts in arthritis, she's a rheumatologist, her name is Susan Bloom. Something that she said recently that I thought was interesting, I want to share with you guys, is that she said that the abdominal fat that people accumulate, the pannus, secretes hormones that actually can cause more inflammation. So when they tested dysfunctional large abdominal fat, it actually released cytokines like we were talking about before, inflammation markers. And when they biopsied the joints of patients with arthritis, they found these same inflammation markers in the joints, which means that that abdominal fat in itself, the weight wasn't causing the arthritis to flare. It was actually the fat secreting inflammation, and that inflammation was traveling and causing pain in the joints or causing inflammation in the joints. So really important to know that if you lose that dysfunctional fat, that abdominal fat, your arthritis will probably get better just because of that decrease in inflammation. So we have a question by Susie. Good morning, Susie. And she says, recommended daily dose for fish oil. Well, anywhere from 1 to 2 grams of fish oil a day. You also want to make sure you're getting a reputable source of fish oil, because there's a lot of sort of adulterated products out there. You have to worry about mercury these days. So the one that I recommend is Nordic Naturals. So if you are going to take fish oil, kind of look for a good, clean brand. Good morning, Roberta. Thank you for joining us. So we were just talking about arthritis, and we were talking about joint pain and inflammation, and how nutrition plays a huge role, and how eating the right foods can help decrease inflammation, how weight loss can decrease inflammation, and abdominal fat loss can decrease the secretion of inflammation markers that might be the root cause of inflammation in some people. And then I went over some supplements. So if you're interested in supplements, I just mentioned a few that I like. Okay, so moving on to MindBody medicine. A lot of allopathic doctors that I practice with, may not even mention or recommend any of these things, but I think it is a big part of inflammation is MindBody. How your mind works and how you think about pain also plays a role in how bad your pain is, okay? So the emotional connection with pain is also an important part. So I'm going to take you through just a bit of science, so just hang in there with me. So you have this nerve called the vagus nerve. It connects to the part of the brain that conducts pain, okay? That nerve also runs through your system to regulate your heart, and it also can shut down inflammation. Interesting, right? So if you can calm that nerve, you can decrease inflammation. And they've done studies, recent studies, to show that that vagus nerve actually can deactivate inflammation. So let's say you got cut in your arm or you got hit in your elbow. The signal goes to the brain. The acute pain gets registered, but that vagus nerve can actually send signals to shut down the inflammation marker and promote healing. Now, how do you activate that? It's through everything that we've talked about in the past. Breath work, heart rate variability. So this is called biofeedback. Recognizing that your pain is only a symptom and a warning. So rather than having a negative attitude towards pain and fearing pain and being hypervigilant about pain and fearful of pain, we're acknowledging that it's actually a symptom and it's a warning sign. And so changing your mindset, resetting how you think about pain can actually help you control your pain. Isn't that interesting? That the brain actually, pain is just a neural phenomenon. And if you can change the way your brain processes and receives that information, it can actually downregulate inflammation and change the way you perceive pain. So it's all about perception. So know that yes, you did get injured. Yes, your joint does hurt. Not fearing it, not being hypervigilant and never doing that activity again actually will cause atrophy of the body, will slow down your responses, affect and loosen ligaments, and make you more prone to injury. So perception of pain is really important. Mind-body work will help you regulate your pain when it's at its worst. So breath work. Frequent techniques that I teach is 4-7-8 breathing. So if you're in acute pain, take a deep breath in for a count of 4. Hold your breath for a count of 7, and then exhale through your mouth for a count of 8. And do that 6 to 8 times. I had a gentleman recently who wanted some pain medication, and through a conversation, I discouraged him to use it. And he was in his car, and he was in pain, and he was sort of like, I just could use some pain medication, but all he had was the words that I'd given him. So he decided to try this breath work. And he came back and told me, he goes, oh my God, it actually did work. Thank you so much for giving me that. I was at first really upset that I didn't get any pain medication, but then when I tried the breath work, I was amazed how quickly it did help. So, incorporate MindBody work when you're dealing with acute pain. And biofeedback through heart rate variability has actually been studied. So remember I told you that nerve connects to your heart, also connects to pain? So they've done studies that if you can regulate your heart through breath work, that same nerve can downregulate pain. So I feel like that's a really important part that we as physicians don't address, is how pain relates to emotional feelings. If you're angry, if you're stressed, if you haven't slept, again, all these things can aggravate the pain further, and you guys can all relate to that, right? So working on that mind-body relaxation can help with pain. Okay, if anyone has any questions about that, please let me know. I'm a big fan of, cutting out those negative emotions, those anxiety and fears. Also, because that just leads to behavioral response, that leads to depression, and that leads to further aggravation of pain. So make sure you're working with your pain in terms of patience and peace and acceptance. And instead of resisting the pain, thank your pain for telling you something's wrong. Know that the pain will pass. Do your breath work, do your relaxation techniques to see if you can help reduce the pain through mind-body work. Deanna has a question. She says, which eating plan is the best to follow for reducing abdominal fat for someone who cannot eat grains or dairy? Again, not eating grains or dairy is probably the first step, so I'm glad that you've decided to kind of cut those things back. Now, I'm still a fan of whole grain, but if all grains bother you, then that's something that you have to do. So what helps with belly fat reduction? The diets that were tested, and I mentioned this last week in the live, are the Mediterranean diet, the DASH diet, the flexitarian diet. Good morning, Karen. Nice to see you. So if you want to lose belly fat, first clean out the junk, right? The sugar's got to go. Sugar is the biggest vice. Most Americans eat about 150 pounds of sugar a year. Children eat 3 times their weight in sugar in this country. So sugar is the biggest vice for belly fat. So that has to go. No candies, no cookies, no sweets, no treats, no extra calories from sweets, empty calories from sweets in your condiments, in your milk products, in your dairy products like yogurt. So look for sugar, start screening that out. That in itself is going to help cut back the belly fat. Increase your consumption of vegetables. I typically recommend non-starchy vegetables, and then of course some low glycemic fruits. I am a fan of beans and lentils. I eat a more vegetarian type diet, but if it's not in your wheelhouse to do that, eat lean proteins and only small portions, no more than a deck of cards or the palm of your hand, and try to reduce as much meat as you can. And that's really it, Deanna. It's really just about clean eating, cutting out all the saturated fats that are hydrogenated and bad for you, cut out all the processing if you can, eat as clean and green as you can and whole as you can. Of course, exercise plays a part, stress reduction plays a part, a good sleep hygiene plays a part. So with belly fat, it's really a composite of the whole picture. Okay. Moving on to the next thing is exercise. So it's difficult when you have arthritis pain. A lot of times patients will say to me, I don't want to exercise. My pain is incredible. You can't get me off the couch. You can't get me off my chair. But it's actually the opposite of what you should be doing. Joints get better with movement. When you move your joints, you secrete an oil that lubricates the joint, and the joint gets better. And I'll challenge you. You'll wake up in the morning and you're stiff as a board, but then as you get going, your stiffness gets better and your joint pain gets better, because movement is actually the cure. So rather than not moving, you really need to start to implement some type of movement if you want to help your joint pain and you want to try to decrease inflammation. But do it in a graduated, easy way so that you can kind of make goals and keep further along. I also recommend that if you suffer from arthritis, maybe you want to do a full sort of basic fitness evaluation. I recently had a talk with a local physical therapist, Christy Shaft, and they offer for their patients and anyone who wants to come in a basic fitness evaluation, and they do a full eval to see what type of fitness you're in and what kind of exercises you should be doing. So I challenge the patients here in Fountain Hills to take advantage of that. Go to the local physical therapy place, get a basic fitness evaluation, see what you can do and what you should be doing. Okay, so exercise is important. Chronic pain is maladaptive expression of learned hypervigilance. I was reading that because I read that this morning. I thought, wow, that's a really strong statement. It's a maladaptive expression of learned hypervigilance. What that means is that you have pain and therefore you don't want to move because you're afraid of more pain. And that fear actually causes a forward loop. And fear, anxiety, and pain are sisters. They live together. So when you fear and you have anxiety about pain, it actually makes the pain worse. So exercise is a component that you have to add in slowly, gradually, and get in the habit of doing small amounts of movement in your day. Start here. You know, you might say, I don't want to be here because I'm too far gone. My arthritis is too bad. Fine. Just get up and, do some simple steps around your house. Walk to the mailbox and back. Walk around the park and back. Then set some bigger goals. Or do some calisthenics in your home. But exercise is a really important component of arthritis treatment. Okay. Some smaller pieces that I wanted to add in. Sleep. Sleep and inflammation have been studied. Poor sleep leads to increased fibromyalgia pain, restless leg pain, in a periodic limb movement pain, and also arthritis pain. So not having a good night's sleep also can increase your pain and inflammation. And so Karen says, absolutely, old saying, no pain, no gain. Exactly. I think that going back to the exercise talk, you do need to move. Not moving is not an option. Get moving, do it every day, set up goals. It's really good for your arthritis. And trust me on that, this is the biggest advice I can give you today is exercise is the key. Okay, so sleep is important. Check out sleep apnea. If you are having a lot of inflammation and arthritis pain and you're not getting good night's sleep, maybe a sleep study is in order. So take a look at that as an option. Lastly, with integrative care, we do like our patients to consider alternative therapies, such as acupuncture, such as osteopathic manipulation, manual therapy like massage. I myself am a big fan of massage, so I do recommend that. They sometimes can use really some amazing essential oils that can get into the soft tissue and decrease inflammation. Some of my favorites are peppermint, capsaicin, arnica. These are nice topicals that can help with arthritis pain. You could do cold packs, you can do warm compresses. So seek out a local massage therapist if you suffer from arthritis or inflammation and see about getting those essential oils into your system if you don't want to take anything orally. And osteopathic manipulations are great. I would be careful, especially if you have rheumatoid arthritis or any kind of fragile arthritis or osteoporosis that we talked about earlier, not to do any cracking of the back or any kind of spinal manipulation because, again, you are at risk of subluxation or fractures. So be careful about anything that might actually injure you further. So to make sure that you're going to a good practitioner and you're being very conservative with your alternative therapies. Okay, so that's really everything. I went over nutrition, I went over supplements, I went over mind-body techniques and how pain and emotional experiences tie together. I did, Karen, maybe you could play it back, but if you have any specific questions about diet, Karen asks, have you already talked about diet? If you have any specific questions about diet, please don't hesitate to comment so that I can go over some of those things once again. I specifically talked about Dr. Andrew Weil and his anti-inflammatory food pyramid that starts with fruits and vegetables, whole cracked grains, beans and legumes, seeds and nuts, some fish, and then keeping very little in terms of the poultry department, which is the eggs and the dairy and the poultry, and then the cheese, of course, and then very tiny at the top was the sweets and the treats. Good morning, Joyce. No problem. I had a little bit of a false start this morning. I had some technical difficulties, so I had started it live and then I had to kind of reset my camera. So sorry about that, but welcome, and feel free to watch the presentation when I post it later, okay? And ask me any questions if you have about joint inflammation and and pain. Next Saturday, I'm hoping to talk about inflammation as well, but this time I'm going to talk about gut inflammation and gut diseases. I know we've done talks before, but I want to bring that back because it's a really big topic. A lot of people suffer from constipation, diarrhea, colitis, and how it ties to all systemic diseases. So next week, next Saturday at 10 o'clock, I'm going to go over gut inflammation and how to heal your gut, and we'll do a gut healing talk. If there are any other topics, please don't hesitate to comment. I met with a parent yesterday who asked me if I was going to go over any pediatric topics. I'd be more than happy to do so. I think my audience has been mostly adults, so I've stuck to the adult topics, but if there are any parents watching or grandparents watching and you have any specific issues that you want to discuss, whether it's ADHD or behavioral issues or nutrition issues with children, I'm happy to do another live with any pediatric topics. Okay, I think that is it. I will wish you a happy Saturday. We are a little gloomy and doomy here in Fountain Hills, and hopefully wherever you are, you're keeping warm. If you do live in the Valley, just know that we have an event this afternoon from 3 to 5 at the Garden, and it is a wonderful event that we have for fundraising for this nonprofit. So if you're in Fountain Hills, come by the library and the community center, check us out at the community garden, and maybe join us today. All right, have a great day. You're welcome, Greta. Bye-bye.